Dr. Pinkey Patel, welcome back to Dubai. It's great to have you at HIMSS TV.
Yes, I'm excited to be here.
Now, we met, I feel, the beginning of this year. You were telling me all about your venture as founder of Myri Health.
Yes.
I'd love to know a little bit more about it. For those who don't know, tell us a bit more.
Yeah, so Myri Health is AI-powered maternal infrastructure technology. We're actually, since we met, are now expanding into preconception, perimenopause, and menopause.
Oh, wow.
But we've been doing pregnancy, maternal care, and postpartum care for the duration of how long we've been around. So we're AI-powered, personalized technology that improves outcomes. And we basically right now we meet the mothers where they are with a multilingual consumer-facing application that allows for remote patient monitoring and truly understanding their holistic behavior, to then also meet the providers where they are. And we can also integrate with EMRs and give them intervention opportunities. So at the end of the day, this was built out of my own lived experience. Background is in healthcare myself, but I felt that the entire experience was really fragmented. And there's so many opportunities to improve maternal mortality and healthcare that are gone missed because of not having those additional touch points.
Yeah, and this is the thing. It's you know what what's really frustrating? Maternal health is a niche when it shouldn't be.
Right.
You know what I mean? The term like maternal,
Everyone's impacted by
everybody's.
I call the mom like the CEO of the family, and everybody is impacted when that experience is not optimal.
And yet it's one of the areas that's underserved globally. And you're trying to tap into that and try and help others who've been in positions you've been, or other experiences.
Exactly.
What are the biggest gaps then that need to be addressed right now in pregnancy and postpartum care, but also the other areas that you mentioned that you've expanded
So
into?
we started as a postpartum D2C app. I launched it 3 weeks before delivering my son while I was working full time. I don't recommend that. But when I launched it, it was like, I don't know, you can kind of become like super powerful when you're like pregnant. I can do it all. Then I did it. And then we had over 350,000 users organically in 44 paying countries. It was only a postpartum app. And I built it backwards, if you will, because I felt like that was the first biggest gap. Because you have these touch points, you should have more. But then when you have a baby, they send you home with the baby. And then you're left navigating breastfeeding, all your hormonal fluctuations, and then you're also keeping another child alive. So in the US, we have one appointment that's standard. It's at 6 weeks postpartum, an average 11 minutes long. You're supposed to understand mental health. Pelvic floor therapy is an afterthought, and then you're done. Unless something is like really wrong with you or you're pregnant again, then you're seen by someone. So that is the biggest gap. Then when you move a little bit backwards into maternal care, there's visits and with the OBGYN. However, there are opportunities to improve and understand, like, why do we have gestational diabetes? Could have that been managed better? Could have been mitigated completely? Or in the US, we're having women that are dying of undiagnosed preeclampsia on the side of the road in rural America. And so it's like, wait, if there were ways to actually leverage AI and remote patient monitoring and technology, we have it for everything else, then why are we not utilizing it for pregnancy? Because at the end of the day, if the mom isn't thriving, that baby's not going to be thriving as much either. There's a NICU stay potentially involved. And that trickles down to even a spouse or a partner, from even a mental health angle of all of those experiences not being optimal.
Now, what was you've told me before that you do reference your own experiences, right, in pregnancy and postpartum. What was the thing, especially as a medical professional? What was the thing that really frustrated you the most? And I know you document this on social media as well. What really frustrated you personally at the time?
So the first piece was at 33 weeks, I left my provider. And that was because she was like, hey, we're just going to induce you at 38 weeks because I have to go on vacation. And I said,
oh, lovely.
Yes. And I said,
so you were inconveniencing them.
I was inconveniencing them. And I said, I know that the lungs and the brain develop the fastest towards the end. So between 38 and 42 weeks, they'll let you go. They'll let you go till almost 41 weeks, right? There's still 2 weeks that I could be cooking this baby. So you're not going to tell me when I'm going to have this baby. And then I started doing research around like the health systems where I was going to deliver at. And like, oh, well, you're going to get an epidural because 99% of women get an epidural at this hospital. And I said, no, I would like to see if I can have a baby unmedicated. Both of my children without any medication. And they were vaginal deliveries. But I didn't like being told how I should have my child. Yeah. And so I personally, watched this thing called Birthing as a Business in America, and that really opened my eyes. And I also hired a doula because I was like, I need someone in my back pocket that's going to educate me and kind of like be my companion. I call Myri now like a companion for women because she was mine. And then the second piece was I was in the labor and delivery room with my daughter. I was having birth, and they basically 2 men walking into the room and they said, let's just tell her baby's in distress and get her out of here because she's been here a really long time and we need to just give her a C-section. And I overheard them and I said, what did you say? An hour 58. And I said, I want the data. And there was nothing wrong with her. I had her perfectly fine. So the clock starts ticking when you go into the hospital. And so you're like, well, I know a lot of, people that they're versed in this space, have done some research, they'll go, well, I'm not going to go to the hospital just yet because they're going to try to give me, it's like, it might just go into I might have a C-section. Because if I'm there too long, I'm inconveniencing someone. So those were the frustrating pieces. And then whenever I went home, I was like, wait, I have this child and I thought my breastfeeding class and the courses that I took were going to be enough. And they weren't. And so my first appointment was for the pediatrician at 3 days postpartum. I'm crying at the pediatrician's office, and I didn't even cry when I had these babies. And I was like, what is wrong with me? My hormones were fluctuating. I was trying to nurse this baby. And that's when I was like, how is the first appointment for the baby? And there's nobody that is seeing me. So there were a lot of different experiences, but those were a few that I felt like I had to advocate for my care.
Of course. And it's so, it's so frustrating hearing that, the induction proposal. And imagine you're a medical professional, so you know why, okay, 2 weeks early is not good. A lot of moms won't know.
You just don't know what you don't know. And you're always in a vulnerable place where you're like, if the medical professional is telling me that, even I felt like, okay, well, I should think about this a little more. This is very scary. When you're growing a baby for the first time, you're questioning everything. And so I just felt like it was not her place to kind of make that decision for me. But then I was nice to, when now Myri doesn't just work with that provider can be a doula, a nurse practitioner, an OBGYN. But I was like, we have to connect these ancillary healthcare professionals who are in the field that are actually helping mothers, because you don't get that much access to OBGYNs as much as you want,
So you're bridging the medical expertise and knowledge with the technology, right?
Yes.
So AI and digital health now, how can they help close those gaps within maternal health and women's health overall?
Absolutely. So at the end of the day, there are so many point solutions. And so whenever we were building Myri and we started pivoting and evolving, we're like, wait, these point solutions aren't going to solve the problem, because at the end of the day, we can't improve the outcome for a mother unless we holistically understand how she's moving, breathing, not just at that one appointment that's 10 minutes long. So when she has her application on her and there's wearables and devices and blood pressure, blood sugar kits that are connected directly to her, we have a better understanding of taking that data. And the more data we get, it improves that modeling for us to understand which intervention opportunities are necessary. Everything from mental health, from pelvic floor therapy, from understanding your comorbidities and your family history is everything that we're taking into consideration. Yeah. And then we're taking that medical, the providers, and we're bridging that gap with them and showing them, look, these are the actual opportunities to improve their health care, because how that directly impacts the health of the baby, right? So it's not always just about the mom. It's actually the quality of life that you're bringing to the world. It's all connected
it's everyone.
From the pills that you're taking to the food that you're putting into your body to optimizing your pregnancy. So
much involved. I'm glad there is a solution that's like Myri Health. And look, as the MENA, it is getting there. It does invest in women's health, not as much as we'd like to see, but we are getting there. And I'm just curious to know, you're expanding here in the region.
Yes,
I'm curious to know, what kind of partnerships are you looking for? What can we do between health systems, insurers, policymakers? What's going to be most critical to enable companies like yourself?
So when I first started having the conversations here, it was really important for me to understand, what are the existing platforms? How does it work? What is the hierarchy of who are the decision makers, and what is an actual problem that they're trying to solve.
You're doing the research.
Doing the research. And that was so key because yes, we're commercialized in the US. There's some similarities on how to do that here. There it's with health plans as insurers as a benefit for reducing costs and improving outcomes. Also with health systems that want to integrate through the EMR and have that capability of understanding the mother's healthcare. And then also we're working with the government and also state plans. So it's like, how do I translate that here? Because it's different. Like we've got ministries of health and so we are starting to have not just conversations, but really looking at how to integrate. And it seems to be some of those are similar pathways, like health systems and also policymakers. I think that's a very interesting. The conversations have been good, and also with insurers as well. So when we started breaking it down, was it the public sector? Is it the private sector? Because you have to be. We would love to be able to show outcomes here. So having culturally competent care is very important for us. And when I built Myri, it all started with trust. I always said, if there's no trust, there's no engagement. There's no engagement, there's no intervention opportunities. And so we nailed that from a mother's perspective. There's often in the US, we're throwing things at moms through the insurance companies and we're like, this is not working for me. This is not easy. I'm not using it. And so the way that we built Myri, it's like, how do I take that? How do I really understand, that we're serving the culture and also we're multilingual. And so like that helps. And so most definitely. So that's where we've had our best conversations is with health systems and also policymakers, and also starting to have conversations with the public sector.
In the localization, local outcomes,
Very
data, music to my ears.
Yes. And that's so important to have that localized data here. But it's just like at the end of the day, a dream would be to, okay, let's go ahead and get not just a pilot, but have the engagement started and then have that diverse data set to then say, this is actually something that matters more in this region, and we're actually improving healthcare in this capacity. But research at the end of the day is what we're wanting to capture initially, because that speaks for itself. Once we prove that out, it's easier to have another conversation with somebody else and say, how can we improve healthcare in your region? Yeah.
So finally, what's next for you?
So we're raising our seed round of capital. We've been very capital efficient. So as in parallel to actually expanding and identifying partners that align with how we're building, we're also raising capital to be able to expand at the rate that we want to.
Well, best of luck with that journey, and we hope to see more of you here in the regions.
Thank you so much.
Thank you, Dr. Pinkey.